Hello everybody, I'm Brian TGH, respiratory therapist here at Tampa General Hospital. Today we're going to go over the heated high flow. Some of you guys may or may not be familiar with it. I know with the COVID-19 going on and clinicals being virtual, so just don't want you guys to forget and get out of practice. So what I'm going to do is just kind of go over some of the indications and also some of the contraindications for the heated high flow, and then after that we'll go through and we will actually set up a heated high flow. Now I do have two separate heated high flows here at the hospital. One, you will see, has a literally has a O2 blender in it, the high flow blender, and also a O2 analyzer. And also the other one we have is just strictly a oxygen connect without the O2 blender and without the O2 analyzer. So what we'll do is we'll go over those. First of all, the policy here at Tampa General Hospital is a heated high flow cannula is a high FiO2 high flow device that provides heat and humidity, and it may only be used in the ICUs, the adult step downs, and we do have a few floors that are approved for it. The patient must be stable and or at baseline for his or her diagnosis and is not in an actual ill condition. Another patient or another situation where you may use it is all the vital signs for the patient are within normal range with the exception of the SpO2, hence why we have it. And this goal will be stated by the physician's orders. Now, some of the criteria for the Opti high flow nasal cannula, it's appropriate for patients who require more than 6 liters of oxygen to maintain SATs above 90. Now, some of the, just real quick, a couple of the contraindications, patients that you certainly don't want to put this on that would not benefit from it, are patients with nasal obstruction, obviously, such as polyps or some type of obstruction, a transesophageal fistula, cardiorespiratory instability, or prolonged apnea, or pending respiratory rest state. Those are patients that have gone beyond this for the use of this. Those patients obviously would be in the ICUs, and we would be looking to intubate those patients. And last but not least, one of the contraindications is if a patient scores less than 12 on the Glasgow scoring chart, they are not a candidate for this patient, for this device. There are a few limitations on the heated high flow nasal cannula. It is one of those limitations are the oxygen therapy has only limited benefit for the treatment of hypoxia due to anemia, and benefit may be limited with circulatory disturbances. Another limitation would be oxygen therapy should not be used in lieu of, but in addition to, non-invasive ventilation. If the patient has acute or chronic CO2 elevated levels without a physician notification. Another issue that you really need to pay close attention to is the patient's mental volume and or inspiratory flow rate will affect the air entrainment and can result in fluctuations in the FiO2. So therefore, a precise FiO2 is unable to be determined while patients are on the OptiFlow system. Adjustments in the flow rate and the blender's FiO2 should be based on the patient's oxygen saturation and or PaO2 measured by a blood gas. So those are some of the indications and contraindications for the heated high flow itself. Now, part of the protocol here at Tampa General is first of all, we will get an ABG. If it shows a normal pH and a normal CO2, we can continue with a heated high flow nasal cannula system. We'll place the patient on 100% FiO2 and a 50-liter flow rate. Now, there have been questions, even here at the hospital, of whether or not we have the capability of going to 60 liters. Okay, some of the patients, all patients, we have the capabilities of going up to 60 liters. The only exception that we would not go to 60 liters is if the patient is wearing a small cannula. The small cannulas, and I will get one out here and show you. The small cannulas simply do not have the ability to go to 60 liters. Otherwise, we will set the patient up on 60 liters. Now, we're going to get once the patient has been set up, we're going to monitor the saturations, and we are going to wean the FiO2 10% every 15 minutes to keep a sat of greater than 90. So, in a baseline, what you want to do is when you draw your ABG, you want your PaO2 and your FiO2, your PF ratio, you want it to be improved, and you want it to be greater than 125, and an FiO2 of less than 60. That's how we're going to continue the protocol. We're going to notify the physician if the PF ratio does not improve and remains less than 125, and the FiO2 needs to be greater than 60. Very important, call the physician. We're also going to call the physician if the Glasgow scale drops below 12. So obviously we have some other issues going on that need to be addressed that the high flow is not going to take care of this patient. And if the patient is requiring vasopressor, we are going to call the physician, because at this point blood pressure is bottoming out. Again, heated high flow, we're not going to help this patient. We've got other issues to worry about. Now, very, very quickly, what we'll do is we will go through the motions here. Well, not through the motions. We will actually set one up so you guys don't forget. Since you've been out of clinicals for quite a while, what we will do is we're going to set this up from start to finish. So when you get it out of the package, you're going to get your humidifier. We're going to slide it in. This is pretty self-explanatory. For those of you that use this, you're probably yawning. All right. We're also going to have our O2 tubing connected to the airvo, to the unit itself. And I typically like to hang this up here so we don't have such a huge mess. And we are going to grab our tubing. Again, guys, this is pretty self-explanatory. It will only go on, one end will only go on. Take all right. Well, that's filling up. And for in. And all right, now that we are plugged in, we have power, our O2 is plugged in, let's turn it on. As you can see, the humidifier is filling. It's very important to make sure that it is filling up. If not, I promise it will let you know after you get it running. When you turn it on, the system will do a self-check. You'll see these little dots going in circles there, kind of like buffering. It's going through the self-test. This usually takes a few seconds. And here it's already preset to go to 50 liters. Our O2 blender or our flow meter is not turned on, so that's why we're showing 21%. And our humidifier is showing 32% right now. So now what I will do is, now also when this screen comes up and you still see the circles, what is happening is, we're going to click over here, we have it set at 37 degrees Celsius. So this is going to continue to circle until it reaches the 37 degrees Celsius, and then it will make a chime noise and giving you a check mark with a circle around it, letting you know you have reached the appropriate temperature and you are ready to go to place this on the patient. Now what I will do is, just for demonstration purposes, is you can feel the flow coming out, because obviously we have it set at 50 liters. What we will do, let's just say the doctor wants 50 liters and 50% FiO2. That's where we need to start out with. Now, it's important to remember that you don't want to go 50 here, because this is going to dictate how much oxygen you have. There you hear the machine now. What's happened is the reason you hear the alarm right now is because it is saying 100% O2 too high. Now, the reason for that is simply because, if you'll notice here, the high limit for the O2 is set at 95. So if you go above 95, you're going to get that alarm. So let's just turn it down. Now again, you hear that alarm, that chime, and it just lets you know that you're underneath your alarm settings. So if you will notice here, it shows you the temperature. We're up to 34 degrees. We still have not gotten the chime that we're waiting for to let us know that we've reached our, there we are there. We are at 34 degrees Celsius. Right now, as we stand, we're at 50 liters and we're at 86%. So if the doctor wants, we said we were going to, for demonstration purposes, we were going to start at 50 liters and 50%. So obviously we need to turn this down and get it to within 50%. And again, that's when we would, at this point, after 1 hour, we would obtain an ABG, and hopefully the PF ratio 2 is greater than 125. If not, obviously we call a physician. We could actually increase it to 60% because within the Tampa General protocol, as we said earlier, that's kind of our maximum guideline that we can go to. So again, if the PF ratio to the PF ratio is still less than 125, we're at 50 liters and we've reached 60%. At that point, we need to call a physician. And guys, that's pretty much it with the heated high flow system. All right, real quick, before I did forget to show you that dictating the flow here on the flow meter and how sensitive it can and will be on your reading. So right now we're still at 71%. So what we'll do is I'll show you, you want to, let's turn that flow down. We just turned it maybe a quarter of a turn, and just that quick we're down to 65%. So I'm going to give it about another quarter turn. We're down to 60%. And again, as we said, that is our cutoff guideline. But right now, we want 50 and 50. And as you turn the flow down, you will hear it in the machine. Now, as a therapist, we typically, you want to be as close to 50% and as possible. I always say plus or minus 2, give or take that 2. Right now, we're at 51%. So at this point in time, we would leave the patient on for an hour, obtain our ABG. Let's hope that our PF ratio is above 125. If not, we proceed with the protocol. All right, guys. This one here is a little more old school. Same principle as the Airvo, the Vapotherm. This one here, because it's old school, we call this the heater on stick. So we actually use the Fisher-Paykel humidification system. Everything pretty much is still the same. And as I told you, this one here does have a blender, and there are a couple of different alarms. We're going to plug this in. And I'm going to connect it. You hear that alarm? It is simply letting you know that you have one of your sources is not connected. So plug it in. Same thing as if you were taking this down, pull it out. Hey, don't forget, you still got one connected here, okay? Trust me, you hear that for too long and you won't forget it. Again, this system, it is set up. Let me grab a humidifier. All right. As soon as we spike our bag, we immediately have our humidifier is filling up. So that looks good. Let's turn on our analyzer. And here you can already tell that your alarm is already going off. Room air is 21% right here. We have it set at 21, obviously. Again, plus or minus 1 on these is acceptable. So our low is 21, high is 97. So what we want to do is, again, for demonstration purposes, let's just do 60. And again, you'll notice on the Airvo, the blender was built inside here, being old school. We have our blender, and we have our O2 analyzer. The O2 analyzer itself literally goes in the T. When you obviously go downstream, and we are, looks like we're at 57%. So if we said we wanted to go, I think we said 60. Let's give it just a minute there. Now, on this system here, your flow meter is your actual flow. Remember, on the Airvo, the flow meter was dictated your FiO2. So you want to be sure not to get those two confused. When you have the old school system and you have the O2 analyzer in line, your blender will be your actual FiO2 indicator. So, and again, I've got it set at 60. Let's turn it just a little bit. That should get us pretty close to being 60%. While that is analyzing up there, what we'll do is we're going to turn on the humidifier itself. Right now it is in the process of warming. Now, if you will notice, you have two indicators here, one for invasive, which is what it's on now. We want to go non-invasive, so you hold the button down until it chimes twice. It is now non-invasive. And you say, what is the difference? The difference with this system is takes it from 37 degrees Celsius to 34 degrees Celsius. So it automatically knows which temperature to put it at. And
that's it.
Up here, we are at 58%. Remember, we wanted to be at 60%. So again, that ±2 on your FiO2, we're in good shape. The most important part here, again, I know I sound like a broken record, but it is the only difference in the two, and depending on where you work, some hospitals will have a lot of these. So just remember, it's old school, we call this the heater on stick. So we actually use the Fisher-Paykel humidification system. Everything pretty much is still the same. And as I told you, this one here does have a blender, and there are a couple of different alarms. We're going to plug this in. And I'm going to connect it. You hear that alarm? It is simply letting you know that you have one of your sources is not connected. So you plug it in. Same thing as if you were taking this down, pull it out. Hey, don't forget you still got one connected here, okay? Trust me, you hear that for too long and you won't forget it. Again, this system, it is set up. Let me grab a humidifier. All right. As soon as we spike our bag, we immediately have our humidifier is filling up. So that looks good. Let's turn on our analyzer. And here you can already tell that your alarm is already going off. The room air is 21%. Right here, we have it set at 21, obviously. Again, ±1 on these is acceptable. So our low is 21, high is 97. So what we want to do is, again, for demonstration purposes, let's just do 60. And again, you'll notice on the Airvo, the blender was built inside here, being old school. We have our blender, and we have our O2 analyzer. The O2 analyzer itself literally goes in the T. One, you obviously go downstream, and we are, looks like we're at 57%. So if we said we wanted to go, I think we said 60. Let's give it just a minute there. Now, on this system here, your flow meter is your actual flow. Remember, on the Airvo, the flow meter was dictated your FiO2. So you want to be sure not to get those two confused. When you have the old school system and you have the O2 analyzer in line, your blender will be your actual FiO2 indicator. So, and again, I've got it set at 60. Let's turn it just a little bit. That should get us pretty close to being 60%. While that is analyzing up there, what we'll do is we're going to turn on the humidifier itself. Right now it is in the process of warming. Now, if you will notice, you have two indicators here, one for invasive, which is what it's on now. We want to go non-invasive, so you hold the button down until it chimes twice. It is now non-invasive. And you say, what is the difference? The difference with this system is takes it from 37 degrees Celsius to 34 degrees Celsius. So it automatically knows which temperature to put it at. And
that's it.
Up here, we are at 58%. Remember, we wanted to be at 60%. So again, that plus or minus 2 on your FiO2, we're in good shape. The most important part here, again, I know I sound like a broken record, but it is the only difference in the two, and depending on where you work, some hospitals will have a lot of these. So just remember, your flow on the old school, the heater on the stick, as we call it, your flow meter is your direct flow. On the Airvo, the Vapotherm, the flow meter dictates your FiO2.